Hello everyone, welcome back to my channel El-levate. In this video, we're going to talk about something that's reshaping access to healthcare, telemedicine. We'll cover the basics, how it works, and take a look at Tena First Plus, which is the #1 telemedicine company in Ethiopia. So what exactly is telemedicine? It's the use of digital platforms like apps or websites to connect patients with doctors remotely. It allows people to get medical advice, prescription renewals, and follow-up care without going to a clinic or a hospital. So I have known about Tena First Plus for a while, and I thought it was just an app, and I also had tried the app, but I came across Tena First Plus at the Ethiopian Technology Expo 2025, which was the biggest tech expo in East Africa. And at first I thought it was just an app, but it turns out they also have a full featured website. So in this video, we'll start by exploring their website, and then we'll dive into the mobile app experience. Here is why this really matters. First, it improves access. People in rural or remote areas can still speak with a licensed doctor. Second, it supports health equity. It helps bridge the gap for underserved communities. Third, it creates new jobs. It's opening up digital roles in healthcare, from remote consultations to health tech support. So telemedicine isn't just about convenience. It's also about expanding the right to health. So this is the result that I got when I searched Tena First Plus. So yeah, let's go to the website. And one thing I want to comment is they are actually very active on social media, and I really appreciate that, because they have like YouTube channel where they have guides, explainers for doctors or people who want to onboard, any health professionals that want to onboard on the website to their system, about the application. And that's really good. I really appreciate that, because it's good to have this. The whole point is making healthcare more accessible, reachable, and it's good to have information as easily to understand as possible. So as I said, I was at ETEX 2025, the Ethiopian Technology Expo, and during that time I did get a chance to speak with the founder and also look at the whole demo of this website. And they have like 922 plus online doctors, 2,321 online appointments. See your doctor anytime, anywhere. So let's scroll down a little bit. Okay, they have top rated doctors, but like there's 0 people. Anyways, okay, let's just see a little bit more. Okay, this whole indicates that a lot of people are not using this. It shows that there's an issue of digital literacy, But anyways, let's go on. This is, are you looking for featured hospitals or clinics? I wonder how many they have over here, because I can load more. Okay, it takes me somewhere else. How many do we have? Okay, interesting. Okay. Okay, we have a lot of doctors and quick buy services. I think this is just something they're planning from what I see. Okay, we'll look at the app. Let's just see. Tena First, I feel like they have a big vision. because they have like courses, podcasts, media, and as I said, they're pretty active online, and they have a pretty big vision, as their motto is also the #1 telemedicine platform in Ethiopia. And that's really nice. I mean, I really like people and institutions that have big vision and that are working towards that, you know. Okay. I wanted to click specialties. Why did I click find doctors? Okay, fine. Let's just we'll go back to the specialties. Okay. So here there are like different so let's check a couple. Nutritionist. I click here. So it brings me a nutritionist when I do that. Okay, they have quite a few. That's really interesting, you know. People should use this more, honestly. Therapist, occupational therapist, speech therapist, prescription refill. Okay, pharmacist. I think I need to clear that. We have one pharmacist. Okay, I was wondering how they would manage the prescription refilling thing. It looks like they only have one pharmacist, and she hasn't been booked so far. I mean, not officially, as far as what we can see on the website. I think specialties is also the same thing. It's the same thing like the one that we were searching on Find Doctors, but this one you can just filter with the specialty. I think it's just different ways. Mental health, they have addiction psychiatrist, child and adolescent. It's nice. I wish I could just try to call one of them, but it's pretty late now. I don't want to. Get brief answers for your health queries from top doctors. It's free. This is really good, guys. This is a gem. Because if you have any health issues, you can go to questions, not health issues, but if you have any questions that you want to ask, you can go here. But is it anonymous? Tena First user. How does that work? If I want to ask, what do I do? Okay, let's see. Login. I need to log. Okay, we're gonna definitely try the login part, but specialties or doctors, whatever it is, their specialization is in, they can answer these questions. So let's try to log in. Like, does it enable me to open an account? I had tried earlier and it just didn't let me. Yeah, it's not letting me. This is one problem. Like, I don't know why it's not happening. But do I need to call the call? Does that mean I need to call the call center and on board? Because maybe that's why people are not using it as much as they should. Because okay, it has languages too. That's great. But I don't know why I wasn't able to log in. Okay, let's go check out the app. I had gotten it before just to see how it was, but okay, there are 343 doctors online. Okay, let's see. It says top rated on the website. It just seemed like okay. Well, you see, 16 plus people's. Okay, audio consultation. So I have also seen on online, they have, as I said, they're active online. So I did see some interviews that they had given. So they have video consultations, audio consultations. You have to log in, I think, to choose your preference. Let me try to log in and come back. Okay, so it's been a while. It's still not letting me log in. And I thought it was the connection, but it's just something else because I've tried to use other things and other apps, other things that would test my connection, but my connection is okay. It's not because of bandwidth or something. Okay. So it's pretty much like the website. It has similar features, I guess. I wish I could log in and see it. We have health tips here. 3 reasons to try virtual visits. Okay. Lifestyle, nutrition, drug information, health promotion, health mids. Okay, this is not active yet. Let's try the login thing again. Let me try with my number and see if it lets me log in quicker that way. So yes, it worked better when I tried with my number. I have been trying with my email, but with my email address, both on the website and on the app form wasn't complying. But in this it could. So let's say I want to book this doctor. She's offline. Let's try another one. How do I get... I wish there was a section for online doctors, not top rated, but I want the ones that are online, not the top rated ones. Maybe it's... you're online. Let's just try. And okay, I need to create my... What if I don't want to create? Is creating a profile a must? So the ones that work more and get more bookings and get more ratings, they get to. So one feedback is I wish there was like a section for online doctors where you could just get in and book and just find but I think it's recognizing me as a healthcare professional. So also from what the founder explained to me, I think the main point is for people that this is for healthcare workers, I think. But that just, I don't know, there's just some things that are not clear for me. Because when I log in now, when I logged in, I didn't tell it if I was a user or if I was a user or a user as in like a patient or a doctor. I didn't get an option to choose that. But I had asked him during text and he told me there were like 4 or 5 profiles. You could log in as a clinic, as a healthcare professional, as a patient, as a pharmacy, as a clinic, There are a few more profiles, but I didn't see anywhere being able to choose from those. Okay, the videos button takes you to their YouTube channel where they have videos. But on for example here, I should have gotten register as an agent. What is an agent? So when I create my profile, I get that. I just think it should be like crystal clear. Like even I do appreciate that they have online guides and everything, but it's also great to have the guides for patients as well, not just for doctors. Okay. So what I saw online is that it asks you like the website asks you your license, where you worked before, you know, all that stuff. I guess maybe if I filled everything here, it will lead me to that page. But if I was a patient trying to find a doctor, does that mean I just don't fill the profile? I don't fill the appointment log? If I just proceed and try to book one of the doctors, let's try to book one of the doctors. Okay, this is online. What do I do? Is there something I'm missing? Like, because public health officer, 12 doctors. How many specialties do they have? Damn. Wow. So I don't know how I would be able to get in, because it seems like when you log in, you're automatically assigned the tag of a healthcare provider, like a healthcare professional. But if I wanted to log in as a normal person, is there a different app for that? Is there a different way? And for people who want to register with their email, how does that work? Anyways, we're gonna park it here. Maybe if there are updates or if there are new developments, we'll do this review again. And also Tena First Plus, if there's something I've missed, you can also drop your comments in the chat. And yeah. Thank you so much for watching. If you're curious about tech and its impact on health, don't forget to like, share, and subscribe. Let's keep pushing for a better access, smarter systems, and a healthier tomorrow. Till we meet again next week. Bye-bye.